So this is RestylaneL. We use different fillers, many different fillers in different areas of the face. Each of these fillers has slightly different properties in terms of how much water it retains, how springy it is, how solid it is. And so for this tear trough, RestylaneL has precisely the right characteristics. The kind of filler that we inject, RestylaneL, is one part of the secret sauce of us doing tear troughs. However, there's other very significant things. If we take a look inside this box, like every box of filler in the world, it comes with needles, okay? These are fancy needles. They're all the way from Belgium. We take 100% of these needles and we throw them away, okay? We take the filler out here. This is RestylaneL. We put it in our little fancy holder, okay? But then what do we do? Instead of using those needles, we use these micro-cannulas. The majority of the best injectors in the world use micro-cannulas, not needles, for the majority of their injections. In Europe, this is extremely common. In the United States, a little less so, but even in the United States, the best injectors use these. Now, what are these things? The micro-cannula is this, and it's sold with a needle of precisely the correct caliber. The needle, you can see our handy-dandy holder, has a little thing to put the needle in. It's designed to accommodate, the holding the filler in this. The real thing is this. This is the micro-cannula. All right, let me attach it now to this. But if you really take a close-up view of this, you'll notice that it looks like a needle, but it's not a needle. At the tip of this cannula, it's blunt-tipped. It's not sharp. And therefore, the hole where the filler comes out is not at the very end. It's like just a teeny tiny bit back from the end. It's got to be in order for the tip to be blunt. So we inject the patient with local. Then the patient is numb within like 90 seconds. But we then wait a few minutes. Why? Because this local anesthetic contains not just lidocaine, it contains epinephrine. And that epinephrine causes vasoconstriction. A common concern with patients when they do fillers is, oh gee, doctor, am I going to bruise? We can dramatically reduce the risk of that bruising by letting her sit for a few minutes, and you can see where we put the local in, she's blanching in all those areas, right? Just like when your doctor does a rhinoplasty or a facelift, in the operating room, we inject you, you're under anesthetic. You don't really need that local so much, but we're injecting the local, yes, to make it a bit more comfy, even under anesthetic, but the real thing is we want the vasoconstriction from the epinephrine or adrenaline that is in this local.